Pennington Biomedical Center on childhood obesity. Good afternoon.
Good afternoon, Chairwoman Barrow and committee members. Thank you so much for inviting us to come speak to you and update you on childhood obesity and the Grow Healthy initiative.
Yes, ma'am. Please introduce yourself.
I'm Dr. Amanda Stiano. I'm Associate Professor at LSU's Pennington Biomedical Research Center.
Okay.
And I direct our Pediatric Obesity and Health Behavior Laboratory.
Okay, great.
So I prepared a few slides, and I'm happy to answer questions as well. As we're all aware, there are serious medical complications from obesity, and unfortunately, we're seeing this even early in life. You can see the sketch here showing just about every organ and organ system of the body is affected by obesity. This is back to school week for a lot of students throughout Louisiana, and we also know that obesity can cause negative impact on academic performance, on behavioral behavior in school, et cetera. So getting proper nutrition, proper sleep, and physical activity for kids is really paramount, and especially for those children already affected by obesity who have a greater risk of developing these really serious diseases throughout childhood and beyond. We know that Louisiana has a particular heightened problem related to childhood obesity because we're the third highest state in the country for childhood obesity prevalence. 13% of our young children are affected by obesity, and over 20% of our school-age children are affected by obesity. Parents in surveys report that this is a high concern for them, and we also know that there are significant economic implications as well for treating obesity. So thank you so much to you and the state legislature for investing in the Grow Healthy program. We just launched this 5 weeks ago on July 1st, and this is a truly unprecedented opportunity to bring 30 years of scientific evidence from Pennington Biomedical and put it into the hands of families, teachers, school officials, and doctors and nurses to really make important strides in preventing obesity and treating childhood obesity throughout the state of Louisiana. We received an investment of $5 million in HB1 for this first fiscal year, and I will walk you through briefly the programs and the work that's already underway to make good use of that investment, and we are very excited to get this rolling. Number one is our virtual health hub. This will be an online portal that is accessible to anyone throughout the state of Louisiana. We are putting our programs, our curriculum, our apps, everything that we've developed over the past several years on this virtual health hub so that schools and doctors and families and parents can immediately access this, download it, and use it. We are also launching the Pennington Generation Cohort Study. This is the key scientific piece of this work. This is how we will evaluate the programs going forward. So we will enroll families from throughout Louisiana, throughout every corner of our state, and we will follow them throughout.
Quick question for you, Senator Jackson.
Yeah, thank you. I'm always interested in where our money is going, and I think you do a wonderful job at Pennington. But tell me about this virtual health hub. How does it work? What benefits does it give the student or the parent for the student who enrolls in the virtual health hub?
Absolutely. So it's a website, and anyone can go onto it. And there will be different categories. We just started this, in the past few weeks. And so, for example, if I'm a school teacher or a school administrator, I can go onto the virtual health hub and download curriculum that I can use in my classroom, in PE, in the school cafeteria. So it'll be everything from actual lesson plans that the teachers can use to modifications that can be made to the school cafeteria, to the snacks and meals that are being served to kids. This is just one example. There'll also be a spot for doctors and nurses to go to receive information, for parents to go to get activities. And what's really special is this is all based on evidence. So we're taking this from our scientific studies and making it available.
Now, on your lesson plans, the curriculum that you have posted, have you worked with the Department of Education on those?
We are planning to reach out to them. We've worked with them about 10 to 15 years ago to initially develop this curriculum. And now what we're doing is we're updating it to the newest nutrition standards. And we would like to connect with them this fall.
Okay, because we're going to be asking teachers to go on that website, right?
Yes.
And how do we know that these lesson plans are going to fit with the requirements of physical education and other state requirements regarding that teacher's classroom? That's always my drawing a real connection to what happens.
Right. I agree. I'll give you one example. We train the school service personnel already on what they're actually their menu plans throughout the school year. So that's a contract that Pennington already has with the Department of Education. And so we are taking the information from those learnings. So both the practical information that we developed over the past few years, and that's what we're making available.
No, I
online.
understand. My concern is more of not a concern. Question is the lesson plans. How do we
Okay.
know if we haven't connected with the state in the last 15 years on those plans, whether these are lesson plans that the teachers can use right now to implement in their classrooms and still be within, the guidelines for their classroom?
Good afternoon, Senator Jackson. Bonnie Email with Pennington Biomedical. The dollars for the Grow Healthy, which is a brand new and an innovative program, was just allocated July 1st. So this will not be online right now. It will take several months for us to create the website and do that. We right now are working
so
with.
let me make sense. So the website is not up and running right now.
No,
Okay, so
because
that was-
we
yeah,
didn't
that's what-
even,
yeah.
it was allocated July 1st. And it will probably take at least 3 quarters on getting the virtual hub and then pushing it out. So just bear in mind that as we do this, we will let the legislative branch and the executive branch know. We're working very closely with Louisiana Department of Education. We have done that for years, but we want to do that, and then we will be reaching out to various not factions, but municipalities, and because some want to maybe do it sooner than others. So it just is going to take some time.
So when
but
you
we
say
couldn't
when you say 3 quarters, we're saying
Well,
9 months?
We're hoping, it's my understanding, 9 months. I will have a report for you guys probably in January or February to say this is where we are, and then various aspects on when we will be implementing various programs.
So when you're developing these lesson plans, are you looking at the state guidelines for the teachers and what they, and that's, it's just
yeah.
kind of
Absolutely.
pointed question for
That's
me.
right.
And are you going to allow the Louisiana Department of Education to review them before posting them so that teachers who are going to this website can feel, educators who are going to this website can feel comfortable using them in their classrooms?
We have a current contract with the Department of Education. I believe it's once a quarter where we work with Department of Education, and it is a quarter meeting where teachers throughout the state can listen. We bring in speakers, and all of that's coordinated through the Department of Education.
Right, and so
I think
these
that will
lesson
be
plans
enhanced.
will be coordinated?
Yes.
That-
Yes.
That's, yes, okay, thank you.
And I would like to add, I've done a lot in the preschool space, and we've created 2 training modules that are coordinated through Department of Education already to train preschool teachers. And so that's our plan, to continue for that 3 to 5-year-old age range, to create modules hand in hand with them that they will then make available to the teachers for the licensing requirements for the training. So
Now,
that's
but the lesson plans, they will be fashioned to be used throughout K through 12, pre-K through 12?
both. We'll do the ones for the early care space, 0 to 5, and then we'll do the ones for the 6 up to through high school. And so, one thing that I think would help our work in that area is to make sure we're getting to the right agencies and committee within the Department of Education. So if certainly if you or others have advice on the best people to work with, we've worked historically with several people throughout the department, but we do want to make sure it's getting to the right people who could review it for us.
And we will. And I'm expounding this concern several times because I've seen things put out and then the teachers cannot, not from you, actually use it because it doesn't go within their curriculum guidelines. I would love to see a strong program in this area that goes within the curriculum guidelines that can really be a great asset, like you've been to our food service workers and others in the area where teachers can pull them down and actually use them.
As an example, one of the things we did several years ago is try and have the vending machines approved in what's happening in various schools. There is an approved vending machine list, and we maintain that for Department of Education also.
No further questions, Madam Chairperson.
Thank you, Senator Jackson. Senator Cloud.
Thank you, Madam Chair. I'm looking at this, I think it was your third slide, and the medical complications of obesity. And as a parent, the way that we live and the way that we eat, our culture here in Louisiana, it's just not generally indicative of healthy eating habits, and that has translated into what are we the top three in obesity and childhood obesity. But as a mom looking at this and what obesity is linked to, the 13 types of cancer, and that opens eyes. It's not just about helping your child, wanting your child to feel good with, Oreos and milk or ice cream or all the fun things, but you're contributing to the potential for cancer and all sorts of other medical complications. And we do so I have a degree in education. We do our very best to equip, our kids with the knowledge and resources at school, but at home. That at home is where we're feeding them. There's nutrition programs at school, what we put in the vending machines at school, but at home and on the weekends and in the summers. To me, you can all the good that you do at school can be easily and quickly reversed with what happens at home, and that is so much beyond our control. And but I think that a big target audience and focus needs to be the parents at home, because I know as I get older and my metabolism is changing, and I'm just trying to equip myself and educate myself more on how to fuel my body properly, and replacing those fun yummy things with things that actually fuel my body. And so what are we doing to, I guess, involve and encourage parents to be more active in developing healthy eating habits at home and equipping them with what we put in and what the product coming out is, whether it's fuel and energy or obesity.
Right. So I'd love to give you a couple of examples of that. So first of all, anything we do with the school curriculum always has a parent's piece to it, right? So whether that means making sure the teachers are able to give the families resources. You're absolutely right that the at-home time, that's actually where we see the obesity uptick as well. So if you follow kids, this has been shown multiple times across this country. If you follow kids year to year, the extra weight gain is typically occurring during the summer months or during the holiday months as well. And so to me, it's clear, and to others too, that school has become a healthy place in many ways, with the school breakfast and lunch program and limiting portion sizes, et cetera. So I think you're absolutely right. For kids who already have obesity and already have signs of early heart disease and diabetes, which unfortunately is a lot of kids, we are developing and testing family weight management programs. These have been around for 20 or 30 years now, and this is the type of program that Grow Healthy is helping us get into the community. So we've already been working with nurses, social workers, dietitians, and doctors to test all of this out, and now we're at the time that we can turn that curriculum over to the healthcare providers. We can train them, support them, because a lot of them didn't receive this in medical school or dietetic school, unfortunately. So that's part of Grow Healthy, is to turn all of this over to them and to provide ongoing support so that they can work hand in hand with the family and the parents to change the eating environment, the activity environment. We're also developing and putting out apps for parents. Again, these are things that have been tested, scientifically tested. We published on them. And so part of Grow Healthy in the next few months is we have an app for motor skill development in preschoolers. So teaching kids how to throw a ball and run, things that we take for granted, but a lot of our preschoolers don't know how to do. And once you get into kindergarten, you don't know how to do these things, you start to fall behind with physical activity, as well as with older kids, actual weight management apps to help kids, if they need to lose weight, to do it in a sustainable and a healthy way, to help them start thinking about what they're eating, tracking what they're eating, but to do it, again, in a healthy way. So I think those apps are geared towards parents and families to download.
And these dollars that we've allocated are not just going to go into school curriculums. They're going to go into the hands of
That's
parents.
exactly right. School is important, so it is a pillar of what we're doing, but you're absolutely right. The family, the healthcare providers, those are just as, if not more important, really, because there's so many kids already affected by obesity that we need a healthcare approach as well.
Okay.
And Senator Cloud, this is not going to happen overnight. That's why Pennington says we have to do something starting at childhood. It's going to take years and years.
It's a cultural
and
change,
years.
really,
It is.
for us.
We're looking at something, it may be 5, 10, 15 years. You cannot change things overnight. We're going to work with our pediatricians, with hospitals, with not-for-profits. It's got to be a multi-year and multi-segment, because the healthcare community has to be part of it too. Maybe an FQHC. Right now, we've got things in the WIC community. So this is so it will take years for us to keep putting things online and other ways. One of our later slides will talk about the emphasis in September. We'll talk in a little while about what's going to be happening in September to create an awareness, not only for parents, but for the media, for policymakers. It's a huge effort that needs to be done, and unfortunately, what happened with COVID, our children became much more obese. They were home, they were not exercising. So we've lost ground, not only in Louisiana, but nationwide.
Thank you, Senator Cloud, and thank you for that explanation. I would just add that actually I went over to Pennington about a week or two ago, and they had the whole full body image, which actually shows even more in terms of how weight affects our body. It talked about the hips, the knees, the foot, etc. So this is really a big issue, and one of the reasons why I keep bringing it back before our committee, because I want us to be first educated, and then hopefully this can become a part of our culture in terms of educating our parents and helping them to understand the impact of being overweight. And unfortunately, many of the scientists have said that some parents will actually outlive their children because of our weight and diet if we don't change it. Exactly. And so to me, this is a priority.
And as I return to the slides, I did want to note one thing we always make sure we say too is, of course, none of us are blaming the parents or blaming the family, right? Because it's the environment that we're living in. And so this, like Bonnie said, this is multi-pronged. And even though we recognize this is a huge issue, it's going to take some time to truly see the numbers, the prevalence go down. There are some deliverables we're going to be able to deliver this year to Louisiana, and we'll be evaluating it too, right? And tracking the usage and the uptake and the impact. So we will be able to show you progress as we go along, even though we recognize this is it's a generational challenge.
Okay, how you guys gonna show us the progress if it doesn't start for 9 months? Did I misunderstand that?
There are our goal is to have something live within about 4 months.
Okay.
Initially. It's going to be a preliminary, and my team and others at Pennington are working very hard to get whatever we can available right now.
Okay.
Right? And so to just go ahead and start putting some things up there. But then some of the things Bonnie mentioned will take longer because we want to be thoughtful with it. We want to talk to the correct partners, make sure we have the correct reviews in place, et cetera. So those are the things I think will take a little bit longer. So the virtual health hub, it'll continue to evolve. If we hear from Department of Education that they want something in particular, they need us to adapt it, we will respond to that and adapt. So that's the part I think that'll take a bit longer.
Oh, okay. Senator Jackson?
And I did go over the education piece, but I think the app and everything is important. It's going to be a free downloadable app for parents.
That's right.
And what type of information will they be given? Like, how's it going to be fashioned?
What was that?
How's it going to be fashioned? Like, what type of information will the
Right.
parents have access to on that app?
Sure. So there'll be a few different apps. So I'll give you one example. One example is the Play app that I developed in the past couple of years. And Play is to promote motor skill development for preschoolers. And what it is, it's for parents. And it basically breaks down some of the common motor skills that we want kids to master into very easy pieces. So how do you jump, right? So here's a 3-second video of a child taking off with both feet and landing with both feet. And it walks through just step by step these quick videos for parents, and then also gives them activities that they can do with their child. And again, these are all things that have been tested and developed for 20 or 30 years now, but it's typically in a research setting, costs a lot of money, involves the parents driving somewhere to get the program. So we're pushing this all out on the app to be available. That study in particular was just published in Pediatrics, one of our premier journals in this space a few months ago. So I'm able to take that app with this funding, make it even more user-friendly, because right now it's a research app, so we're making it look more slick and polished, and then put it out there. And the goal is to have that available on the App Store by December or January, so that way any parent can download it and access it for free, and it'll provide. And that's just one example. We have apps for nutrition and eating plans. We have healthy weight. You know, if families really would like to lose weight or slow down their child's weight gain, we have apps that will help them do that. So that's what we're trying to do, to tailor to what the families are interested in and want to use, and make some varied content available. But yes, to make it all free for families.
Thank you.
So what we did is, Pennington, as you know, is world-renowned. We're a research institution. But what happens with that research? We need to push it out or translate it to a community. The community may be an urban setting, or it may be a rural setting. So what these dollars, what the state is providing, this ongoing relationship with the state, is it's allowing our research to translate it into the community. So what we've been researching goes right to your constituents, right to your families. You may say, well, I've looked at this, or my family, you know, I know most of you probably do health fairs. This can be something that you can promote and then say, well, our community would like to do this, or the YMCA would like to do this. This is something that is, since we're doing this, we can then have it very nimble and create things that work in communities.
Mm-hmm. And we've started having conversations, for example, with Medicaid plans and FQHCs, et cetera, to try to figure out, as we're creating these things, how can they integrate it into what they're already doing?
Okay. Mm-hmm. Well, certainly, we are very proud of the work that you guys are doing at Pennington, and y'all have received a lot of accolades, and definitely very deserving for some of the work that you've done. And we're looking forward to more work that you're doing, especially in this space. Senator Mills, Chairman Mills.
Thank you very much, and thank you for your work, and I echo that too. And your slide presentation is very informative. I know what you were talking about made a lot of sense. Is most of the legislature, we go into the classrooms and we teach like a little civics class, and in those classes we kind of break down the process of how a bill is passed. And it's been very, very good and well received in the school system. You know, if y'all could provide, or as you're doing your research, you could provide us one of those kind of little talking points. We come in, and the national associations provide us like a little tape. It goes through the process. Then after, we answer questions and we talk it through, and it's very informative. And I know this would maybe be a good thing for the legislature to put it in their outreach when we go to the school systems and we talk it through. I guess the other piece too, I was just wondering is, have y'all partnered up with kind of maybe some of the big pharmaceuticals? Like, you know, I know like they're starting to use continuous glucose monitors with even children right now, and it's such a tool to help people to understand what they're eating, the order of how they eat their food. Are you looking at those type of things? Because I think the problem I find when I go and try and teach that in the schools is people just don't know what nutritionally is good to eat. Mm-hmm. You know, you go to the grocery store and it says good, but it's loaded with carbohydrates and you're eating a horrible food. So if you look at the labeling, you don't even know what you're looking at. Mm-hmm. I heard a nutritionist say that the best thing to do is don't buy anything in the middle of the store. Buy it on the edges, and you'll eat the right food. Right. But talk a little bit about that. Is it something that we just, when you go to the grocery, you don't know what you're buying.
Right. So there is definitely that basic nutrition education, hands-on reading the label, learning, right, that needs to continue because a lot of parents miss that and didn't get that either, right? So it's educating children. The medication space is extremely exciting to me right now. Now, I'm a behavioral psychologist, so I'm very trying to figure out how to help families eat healthier and move more. But for some kids, they would be eligible for medications, and the FDA is starting to approve more medications for younger kids. And
But
I
like
think
continuous glucose monitors?
continue exactly for kids who are pre-diabetic or have diabetes, and others that might help them to lose weight initially, to help them kind of get a jump start as we're working with them to change those behaviors and habits. So Dr. Daniel Shaw at Pennington is a pediatric endocrinologist, and he's involved in all those big multi-site medication trials, and he is very interested in how to help support our healthcare providers in the state to feel comfortable prescribing those medications when appropriate, and for the kids who qualify for weight loss surgery as they get older.
And one last thing, Madam Chair, and I'll be finished with it. But we passed legislation a few years ago that allows for like a joint use agreement. And that agreement would be like, let's just say the Boys and Girls Club in a small rural town would want to provide some opportunities for recreation. They can sign a contract with the school system. And in that school system, it would basically be liability free unless something really crazy went on. But I just find if in the summer, a lot of those tracks and fields could be used. Right. You wouldn't have to build a lot of infrastructure. You have it already there in those little rural towns.
That's a great point. And when you look across the nation, that's one where that Louisiana is I think, ahead of the game as they should be with those joint use agreement opportunities. And that's something we could look into for Grow Healthy. Some of this might be supporting those organizations to connect to the schools to use those facilities.
Yeah, I think in other states it's been real successful, but I don't know if we've penetrated a lot of the school systems here.
Right.
But just a thought.
That's a great idea.
Because what I think a lot of rural legislators is a lot of these organizations say, let's build something, and you really can't afford it in these small towns. But you've got a gymnasium, you've got a football field, you've got resources that we could partner up with. But anyway, thank you all for your work, and your slide presentation is very good.
Thank you.
Very good, Mr. Chairman. So as I'm kind of going through the rest of the presentation, look like through the questioning, you pretty much have answered everything or maybe presented on everything. So I see that you guys, the funding was actually received and being implemented. The virtual website and stuff is kind of on the way. I see that you guys have advertising for job positions. That's still ongoing. Yeah. Okay. And then some other things that you have listed here. Is it safe to say, because our last hearing probably for this year will be in November, would you guys have an idea by November what it's going to look like?
We would. I think we'd be able to show an example. Bonnie, am I too optimistic?
I had asked Dr. Kazmarzik January.
Okay.
But we can give you an update in November.
Okay.
It may not be as thorough as I was asking for in January, but yes,
okay.
I will make a note of that.
Some of these will be national hires as well, so it takes a little, like the director and the project manager, to identify and bring those people in. But we already have a robust team at Pennington, myself and others who are working on this.
Okay.
So do you want us to pick up on slide 9 for time, or do you want us to go back?
Yeah, I think we're pretty good. I mean, I think you guys, unless there's something else that you really need to share with us that's not listed here. I see that there's an upcoming conference Thursday, September 29th.
Yes.
Yes.
Yes, we invite all of you, you and others to attend. So it's a partnership with the Department of Education.
Okay.
We do a quarterly series, and this is an actual in-person. We expect perhaps 400 people to attend to come to Pennington's campus. And we'll be talking about Grow Healthy and other initiatives related to child obesity.
Okay. This would be a great use of your time if you can get away from your districts to go to this, because this is an all-day conference just on childhood obesity. It is so important. The other thing I'd like to stress is September is National Childhood Obesity Awareness Month. So last year, Pennington Biomedical teamed up, you want to talk about?
Sure. With the Louisiana American Academy of Pediatrics and a number of healthcare providers around the states, mostly pediatricians, and we created a healthy alphabet series. So each letter stands for a different health, the A is for apple sort of thing, but we actually went to a school cafeteria, filmed the cafeteria workers and some students to show these are some easy strategies that families and schools can use to promote health and raise awareness about child obesity. So we'll be posting all of those videos throughout September on various social media platforms. And we encourage, if there's an opportunity to repost or retweet, and we'd be happy to hashtag this committee to spread the word.
I was just getting ready to say, if y'all would send that information to us, that would be most helpful.
And Senator Jackson, there was one of them is there's a pediatrician, a young pediatrician from the North Shore, and she and her daughters are cutting apples, and then they talk about why is an apple healthy, exactly the things that you were talking about. So we partnered a couple of videos with LSU Ag Center, and those are the types of things. They get a lot of hits, likes on Facebook, because these are just regular people talking about childhood obesity and eating healthy. And we target maybe blueberries and watermelon, or some people have gardens. So there's a little boy in the garden, one of our faculty members. So if you can repost, I know some of you are very active on social media, that would be great. And then what we'd like to do is maybe 60 seconds, show you end kind of a video. We hope it works. Yeah. Thank you.
Okay, thank you. Oh, Senator Jackson has one final question, I think.
Most likely a statement. You talked about partnering with LSU Ag. I think that's really needed in the urban areas. I know in my district I have rural and urban, and we passed out garden boxes. That was one of my major initiatives for the spring and going into the summer, for children to have these 4x4 boxes that they could even put on concrete. Mm-hmm. If they stayed in apartments, and grow their own vegetables. We found that the kids that did, when we went back around to the churches, we gave them the churches and everything, the kids are eating what they grow. What we found with young kids who would usually push their plate away from vegetables and fruit and things, they eat what they grow. And they became very interested. I would love to see, and we partner with LSU Ag on that. They can tell you about that. But implementing that, sometimes kids are in what we call, food deserts. Mm-hmm. And that was really remedied for some of those children who took a lot of care of their gardens and are waiting on their next roll of seeds for the fall. But that's something we found to be beneficial, is partnering with the Ag Center like you are, but in a way that actually puts that garden in that child's home. Mm-hmm. And the community gardens, you don't always have to do that. We have a couple of community gardens that we've started, and some other elected officials in our district. And we find that if children are visiting through programs, community gardens, and taking a part in them, they're more amped to eat what's grown. Yes, so that would be a strong suggestion to continue your partnership with LSU Ag, but in a way that actually boots on the ground. Kids learning about vegetables from being, and fruit from actually being in those gardens.
Mm-hmm. Thank you.
That's a wonderful idea, Senator Jackson. And Jeremiah had the opportunity this summer to participate in a little garden program, and he was able to bring back some snap beans, and we cooked them He absolutely ate them. I mean, the whole bowl. They were really good too. All right. Thank you though very much. We appreciate it. And if I don't have you guys come back next month, definitely we want you guys to be back in November.
Okay.
Okay. Thank you.
Thank you.